when you were in medical school, were you told that when there's a pandemic, this is how it will look like? And if you were told, is what you were told playing out?
Thank you. These are extraordinary times, obviously, and we've become very busy, the healthcare workers. Nobody expects this kind of magnitude and for cases to be rolling out the way they are. But this is something that you should always be prepared for, because we have smaller outbreaks. You may have an outbreak in a hospital setting, in the neonatal intensive care units, that must be managed. And so for me, this is a larger form of those kind of outbreaks. And if we've been managing outbreaks in those settings, there's the same principles that must be applied nationwide, and obviously taking it to a larger extent. And so these are things, I guess, we are not surprised about it, but we are managing it.
Does it require a lot of physical strength?
Absolutely. There's so many things to do, from preparation, from training, from actually seeing cases. So yes, there's a lot of things that go into it, and you get overwhelmed at the end of the day, but when you finish, you know that you've done a good thing and you're satisfied, and you're just praying that this will end for you to go back to normal life. Okay.
Those of you who have families, has it thrown your family life overboard, out of gear?
Well, for me, I've had to take my 2 children to be with my mom, because I know that I stay out so late, and unfortunately I'm not able to have so much time with them. But I just tell myself that this will get better and then we'll get back to being a family again. But I understand that we all know that because the children are also at home now, they need more time with their parents. But unfortunately, as a healthcare worker, this is a time that most of us are not able to spend so much time with our children.
So where do you operate from in terms of the teams that have been put together? You operate from Kolebu Teaching Hospital, or which hospital?
So I work in Kolebu Teaching Hospital, but I'm part of the National Case Management team. So sometimes I go to the Ghana East District Hospital. Other times I do other things as well.
What is infectious disease specialist?
This is the specialty of medicine that deals with the prevention, diagnosis, and treatment of certain infections. So there are different types of infections. You may have bacteria, you have viruses, like what we are doing now, the SARS-CoV-2 is a virus. You may have fungi. And these are all different organisms that cause infections. And we are trained to understand the nature of the organism, how it works, how it acts in its natural habitats in humans, to understand its cycle and to take that cycle in management. For us, our major role is even in prevention, because if you can prevent that infection, then you don't actually get to the point where you need to treat. So prevention is also a very essential part of
because you're a pediatrician, is all what you're saying for children?
So no, it's not all for children. It's the same concept.
Okay.
But of course, children have their specific diseases and adults have their specific diseases. When we even talk about one branch of infectious disease, it's in antibiotic resistance. And this is something that occurs in the hospital. It doesn't matter whether it's a child or it's an adult, but it's also another branch that we are very concerned about. So that's antibiotic resistance.
So why did you, I'll get to the main conversation, but I'm interested in your career. Why did you choose to be an infectious disease specialist?
Well, after finishing as a doctor and becoming a general doctor, initially I thought I'll actually be working in the neonatal intensive care units. But
what's that, by the way?
Working as an intensivist, taking care of very small children, so babies who are born and who have problems. They are put in.
So you've always had a love for the pediatric thing?
Absolutely. I've always had a love for the pediatric. But somehow I just started gearing towards the infections, and especially it started with an interest in antibiotic. I always thought that people were abusing antibiotics too much. You have a cold and then you take an antibiotic. You stop, you start, and that generated my interest. And I just decided to read more on it, and I found that very interesting, and I've learned a lot from it. So it actually started from an interest in abuse of antibiotics, and then I continued. What
should pregnant women do in this situation? Should they have a certain protocol? Do you wish you could design a certain protocol for them, for they themselves, for people who are around them, and for people who encounter them as a result of work or just meeting them in town, or those who see them at the hospital?
So if you talk about protocol, it would not just be me, but they would need the obstetrician, the gynecologist to be part of, to design a protocol for them. But generally, we don't think that pregnant women are so much at risk just for SARS-CoV-2. That is actually the virus that causes COVID-19.
What's it called again? SARS?
Yes, severe acute respiratory syndrome, coronavirus 2.
But we all call it COVID-19.
That's the disease. That is coronavirus infectious disease.
Oh, the COVID-19 is the disease?
Is the disease, yes.
So that what SARS-CoV-2?
CoV-2, because there was SARS-CoV. The initial SARS-CoV, which bears similarity to this SARS-CoV-2, occurred in 2003, and it has a homologous sequence to the SARS-CoV-2.
So that's the virus?
That's the virus, the
and
name of the
diseases.
virus.
So you have a different name for the virus and you have a different name for the disease?
Exactly.
Okay, all right, I get it. SARS-CoV-2.
SARS-CoV-2, that's the name of the virus.
Causes COVID-19.
Yes.
Okay, good. So go ahead with pregnant women.
Yes, so like I said, it will be a team to actually develop protocol, and I believe that they have something like that. But in pregnancy, we know that there are certain changes in their immune system that makes them more vulnerable to getting infections. And that said, especially in the third trimester, we know that pregnant women tend to have more infections. Even if they had a flu or influenza, some of them may develop more severe complications. And that said, we would advise that during this time, they should continue with their routine care, because you don't want to get to the place where pregnant women will also not be going for their vaccinations, for their routine care. Remember that pregnancy can be complicated, so they still need that, but they need to practice the physical distancing. If they're going out, they need to wear, to mask it, because we know that now CDC is recommending universal masking for them all. They need to do other things, like if somebody had a flu, you're quite ill, you may have to call your doctor and speak to them. And I just must say that if you have a cold and you're wearing a mask, it's not a new thing. These are things we should have been doing already as a people.
Oh, really?
Yes, if you have a cold, you don't...
A common cold, you need a mask?
You should, because you don't want to, it's infectious. So you don't want to infect other people. And so we've made up so much noise of SARS-CoV-2 and masking, but this is something that we should be doing as a people already. So I'm glad that this message is going, and I believe that from going forward, this is the way that Ghanaians are going to live.
I see. So pregnant women should observe those things?
They should absolutely observe those things. They should continue with
If a pregnant woman were to get infected, is your unit prepared for that?
Absolutely. If a pregnant woman was to get infected, of course, she'll be looked after by the obstetricians who liaise with us, the pediatricians and the pediatric intensivist. And the woman should be monitored as usual, should have her checks, continue with her hematinics, and all that she's doing, her scans will be done. And at the time of delivery, then baby will be monitored as it should. And when baby is delivered, the baby will be delivered, will either, depending on the state of the baby, he may need to be either in the intensive care unit if he's
Will the baby
ill.
automatically be delivered with it, with the infection?
Okay, so that's another area that so far there's no evidence that shows that it's transmitted to the baby. That said, there have been 2 newborns who have been born, and after 36 hours, when it was about 30 hours, the baby was diagnosed with SARS-CoV-2. Now,
Did the mother have it?
The mother had, this is the baby whose mother was positive.
In Ghana? You're talking about
No. This was not in Ghana. One was in China and one was in So now this baby, they did tests. So if you want to really know whether it's from the mother to the baby, you do test on the placenta, amniotic fluid, and all that, and it was all negative. Okay, but it was the fact that the baby was diagnosed so early, there's a suspicion that it could be, but all those other samples were also negative. However, so is it that the baby picked it up so early, or also depending on the viral load that is in those samples, you may not pick up anything. So it's currently not conclusive whether it's still transmitted to the baby. We know that SARS-CoV that occurred in 2003, there was no evidence to suggest that that was a mode of transmission.
But in Ghana, we have not had any case yet of a pregnant woman.
There's one case of a pregnant woman, I believe that was in Bolgatanga. She's actually doing well.
She's recovering?
No, she's well, she's stable. I don't know what you mean by recovering.
I mean, a pregnant woman diagnosed of COVID-19, that's what I'm saying. And there's one case.
Yes,
and
I know
you're
of
saying
one
she's
case.
doing well?
She's doing well, she's not, she's currently doing well, to the best of my knowledge, yes.
That's interesting. So the baby must be born for us to make that determination?
The baby, and I would hope that we could do the same things because it also leads to research. I mean, we increase the general research. We also have a baby, we can test the amniotic fluid, the placenta for the organism and see that is it in the baby. And we would have to test the baby also as soon as the baby is born. And again, I must say that when a baby is born in that manner, initially the baby, you would want to isolate the baby with the mother, okay? And then monitor the baby as well. You do your initial test and you have to repeat the test as well. This is a time that you don't need visitors to come into where the baby and mother is.
Even if they're at home? And
Absolutely. Even if they're at home, if they're in the hospital, wherever, I think there's a time for us to also decrease. The Ghanaians, we are very friendly, which is good, but there's a time when you should withdraw a little bit, okay? And this is a baby who is born in with that possible diagnosis. This is not a time for everybody to go in and visit.
Go and visit the baby and
exactly
and look and see who the baby looks like and try and see which
Absolutely.
ancestor has been reborn.
Yeah.
Okay. So places for children like maternity wards.
Yeah.
And pediatric intensive units. How should they shape up in these times?
Okay. So one thing that has generally been lacking, not just in maternity units and pediatric units, is what we call isolation wards. If a hospital is being built, is being designed, you need to work with other people, including infectious disease specialists, to actually design the hospital or the wards in such that you have what we call isolation rooms. And that, I believe, is one of the challenges that we are having currently, because we had not prepared, we don't have isolation rooms. But I must say that there are certain organisms, like you have TB, the person is in the hospital, must be in an isolation room. You must wear an N95 when you are going to see that person. So these are things that should be our normal practice. So in this current pandemic that we are facing, we should have isolation units. So just as I described for that baby and the mother, they should be nursed in that isolation unit. You should have staff that are trained, COVID response team that are trained to manage them, and they should be able to wear the appropriate PPE to be able to take care of them, and also know what to manage, when to do the tests, things like that. So you should have that team. Are you
expressing a concern that we may not have enough isolation for maternity and pediatric intensive units in Ghana among our hospitals?
Well, I'm saying that what I've noticed is that this has not been a practice already. But going forward, it's not anything new. I mean, there are some isolations that you can just design and create that this ward will be used for an isolation ward. You can just designate a certain ward to be, but of course it might have certain features. I mean, natural ventilation, it should be depending on where the ward should be located. You don't want it at the beginning of your the hospital, at the beginning of the ward. That is your isolation units. No, these infectious disease units have a specific place. So I think that going forward, we can just think of these things and make sure that these are parts of our hospital structures.
Is it true that children are at lower risk? Children of the age of 5 to 11, is it true that they are at lower risk?
So initially, the data that was coming from China, there were fewer children that were infected. But I saw this data from South Africa, I think by 23rd March, and about 29 children less than 10 years had been infected. So again, it depends on the geographic location where you are, and I even think of maybe underlying illnesses. But it's not just children at lower risk, but they tend to have mild disease. So we know that every range, I talked about the baby who was infected after 30 hours of birth. So it's a range of diseases, but children actually have mild or asymptomatic disease, and that's what tends to happen. And there are different reasons that have been ascribed to this. For the SARS-CoV-2 to attach to the cell in the body, it needs a receptor. A receptor is like you're receiving, what it uses to receive. We have this enzyme that is called angiotensin converting enzyme 2 that is used to attach. Now, these enzymes are not so developed in children. So that's one of the theories that have been postulated. Also, the immune response. You see, in patients who tend to get severe critical, is by day 7, day 8, day 9, then they tend to deteriorate, because you have what we call a cytokine response. You have this immune response that is going on. Your immunity should be helping you to fight infection, but somehow they just go overboard, and then they start to drive up, and then they call other cells, and then you have what we call adult respiratory distress syndrome. Now, in children, the humoral and the cell-mediated immunity is not so developed. So again, it becomes another sort of protective barrier. The third thing is that you don't really expect the child to be caring for infected children. So they are less likely to get infected, because it's the adult who is going to care for that person who is also infected. There's the other theory of immunoglobulins. Immunoglobulins are proteins that contains antibodies used to boost your immune system. Now, our children are always having infections like RSV, that's another viral infection, respiratory syncytial virus infection, and then other common cold, rhinoviruses. So they're always producing immunoglobulins. In some Chinese studies, they have used immunoglobulins to treat people. So these children have these immunoglobulins, which naturally from their infections, and it's also thought that is also protecting them. That said, even if the children may be asymptomatic, is it also that they're asymptomatic, so we don't pick them up? Or children may be even having other manifestation, atypical symptoms. When children have viral infections, they may have diarrhea, they might have vomiting, but our case definition talks about fever, respiratory diseases. So maybe we are not even picking them. So there are different reasons. Whatever it is, we just need to know that there may be a significant spread of community disease. And that is why this physical distancing is so good. The schools were closed down because if the child is asymptomatic and he's near an elderly person or somebody who is at risk, then they may infect the person without the child even being infected. And this is a new virus that we don't know how infectious, what kind of dose of infectivity you need. So is it that somebody who is even asymptomatic is spreading, or somebody who is pre-symptomatic before you develop symptoms is spreading? Data suggests that there are some people who have been asymptomatic, never had symptoms at all, but they were found as the source of the infection. So it's a whole range of things. And
that is to say, they don't have the symptoms, but they carry the virus and they are able to spread the virus.
Absolutely. Some
before
data
they show the symptoms.
So there's the before, that's the pre-symptomatic, before they show the symptoms, there's a group like that. And there's the asymptomatic. Throughout, they never had any symptoms. They were just screened, maybe because they were contacts, they were screened, and then
they never had any symptoms. But they were able to spread it.
They were able to spread it.
And they never also showed the manifestation.
Throughout. That is the asymptomatic.
So they had it and it goes away.
It goes away.
But during the time they have it, they've spread it.
They could spread it.
But they will test negative after it goes away.
They will test, yes. And you know that, yes, this was an asymptomatic.
So you when won't find out how these persons got it. Those who get it out of this person.
Those who were asymptomatic.
Yes, the contacts who get it from that person. It will be difficult for you to determine how those people got it.
It's difficult to determine.
Almost impossible.
Yeah, but except you have been able to trace, and then you tested those asymptomatic people, and then, but so it's all part of this whole contact tracing that brings these things.
But if a person gets it and it goes away by the immune system, and you test, is a test able to show you a history that it used to be there, is no longer there?
So that would be serology. And we are not doing that in Ghana. It's been done in other places. The serology is when it will show immunoglobulins. When you have an early infection, you have a type of immunoglobulin called IgM. That is for an early infection. And when you are recovering, you have what we call IgG. So that will tell you that. So if maybe 2 months.
So if you test and it's showing IgG, it means he had it?
He had it, absolutely. I've told myself that I'll be doing my serology after this whole thing is to see whether I had it or not, yes.
Oh, that's interesting.
Yeah, absolutely.
Okay, so that's for research purposes. So you can tell that this person had it, never manifested it, never showed it, but possibly transferred it.
But possibly transferred it.
That's complicated.
Well, it's not so complicated. And again, even in the asymptomatic cases that were described, somewhere the testing was by PCR. And as I said, it was because they were doing contact tracing, and then you were able to locate. So, because maybe the person had contact with, I remember one of the cases, the person had contact with certain Koreans. He went for a meeting, and they thought that the person was infected there. It was a German case, and that person was thought to be an asymptomatic.
I don't know whether it's too controversial to ask you about this, but we've heard of herd immunity. That because we are prone malaria, and those of us who are very old, we've had malaria forever, we have already developed immunity towards COVID-19. Is that something that we should think about?
There's no data that suggests that, no research. And I mean, malaria, it's a protozoa. I told you that different organisms. This is a virus we are dealing with. So it's a whole different thing. I believe that maybe it's because we are using...
So it's not a very sensible analysis?
I wouldn't say sensible, but I'll just say that I don't...
It's on social media.
Is it? Okay.
Should we dismiss it?
I don't do a lot of social media, unfortunately.
What is the role of prayer? I mean, in this program we have interviewed pastors, we've listened to the Archbishop, and how much place should we give prayer?
Okay. Being a Christian myself, when people talk about the fact that it's Easter, oh gosh, it's Easter, and we're not even celebrating, there's a scripture that comes to mind, and that God rebukes his people and says that, I hate your religious festivals, I'm tired of your suffering, your sacrifices that they do not please me, but instead show justice and live righteous. And this scripture is repeated in Amos, I think 5:21 to 26. It's also repeated in Isaiah 1, I think verse 11 and 12, and also Micah 6. If you go, it says the same thing. It talks about God being offended by our religious. That's not what he's interested in. So for me, I just think about it.
That's interesting. He's not interested in we gathering at church and all those things.
Well, I'm not saying there's a place for that.
I like the Amos one.
Yeah, the Amos is Amos 5:21 to I think 26 or so. He'd say,
okay.
But show justice and live righteous. And when it comes to justice, it's justice for people, justice for the vulnerable in the society, justice everywhere, in your workplace. If you see that's kind of unjust, and living righteous. And I can just easily relate to, in my line of practice, we have children who are infected with HIV. And I guess anytime I get a platform, I talk about this. They do not have good drug formulations. They use drugs that nobody is using again. They talk about drugs, and it's just that we don't have good drug formulations. For me, that is injustice. It's injustice that they are giving tablets, we cut it into 6 or 8 pieces, and we give to them. That is injustice. And if I can't do this, and I'm in church Easter, and I'm so happy, and I'm dancing, and I'm sad because of COVID, I think that there's greater harm being done to all those children who have HIV and are not on good treatment. I heard that the drugs will be coming in April, and I just pray that COVID is not going to stop some of these things.
So when a patient has COVID and they call you up and they say that a pregnant woman or a child or those people that you've been trained to look after have COVID, they're going to come and see you at 10 o'clock, and you call them back at 11 o'clock, and they are not coming, and you are worried, and they say that we are waiting for the pastor. What will be your reaction?
You need to talk to them. Like, sometimes you actually need to talk to the pastors to release the people to us, because God...
They want to pray for the people first.
It's fine. You can come to the hospital. That's why I said sometimes you need to even talk to the pastors. Bring the person to the hospital.
And come and do the prayer.
Come and do the prayer in the hospital for the person.
Or you can do the prayer remotely.
You can do the... In these times, obviously, yeah, because of the physical distance, you can do the prayer remotely. God listens. God is everywhere.
But they want to put anointing oil on the child before, and the mother before they bring.
Then come to the hospital.
And put the anointing oil.
And come and do that if you want to do that.
I see.
Yeah.
Okay. Thank you so much, Olivia. What would be your last word of advice to Ghanaians as a member of the case management team?
I just want to say that I hope that programs that are ongoing do not stop. Children who are being immunized, these programs must continue to run, and especially for, we're saying physical distancing, but the mothers who need to take their children to the clinics, the hospital, must continue to have their immunizations, because we don't want to end COVID and now have a new wave of infections because somebody didn't have BCG. So now I'm seeing TB meningitis. We don't want to see that. Also, HIV programs must continue to work. The babies who need to be tested at birth, who need to be tested even at 6 weeks, those programs must continue. They must come back and check their results. We don't want to finish again COVID and see so many children infected with HIV because maybe the mother was not on treatments, the mother's viral load was high. I'm very passionate about HIV, and I think that's one of the things that, yeah.